Every code cart is labeled airway, medication, supplies, IV, mask, and gown. This code cart video is not to show you how to run a code, but to show you where everything is on our code cart, to get you familiar with our equipment. This binder is important. It needs to go with the code cart, like right away during a code or rapid response. And immediately you need to designate a scriber that will start writing information, okay? That scriber will thumb through the back and find either the rapid response forms or the code blue forms. At the end, there's an evaluation form, okay? It is very important that the scriber keep perfect information and timing on blood pressure, pulse, vitals, medication given. All that documentation needs to be perfectly written down and called out back to the healthcare person so that we know it's been 3 minutes and we can give epi again. Also, the scriber will have this book, and there is algorithms in this book for different types of problems. A suspected stroke, you got an algorithm. You've got algorithm for BLS, pulseless arrest, and tachycardia and bradycardia. And all you have to do is follow this algorithm, and it literally will walk you through what needs to be done. The overhead page is pound 311 or 3100 still works. Overhead page, code blue, unit, room number, wait a little bit, call it over again, room number, unit, nice and clear. The old code cart and the new cart. We don't have the red airway box for intubating anymore. We're not intubating, we're using the King airway. So everything for respiratory, other than the ambu bag hanging on the side, and the tank is in this top drawer. So what we got here is the two sizes of the King airways for 5 to 6 foot and over 6 foot. All right, instructions on insertion. It's going to be RT or the resident to insert this. It's a lot easier than intubation and the LMA. This is why we switched to it. All you do is you put some lube on this one and here. The more lube you put, the better. You could put 2 of them on there. So it'll slide in. Once you get the lube on there, you go in the side of the mouth all the way down, and you go the marks 15, 14, 15, and 16 right there. Blow it up, 60 mils. And check this pilot balloon. When it's super full, you know you're close. All right, that's 60, and this balloon is pretty tight. So we're gonna put the CO2 checker on there and look for color change. And we're there. It's that simple. They go by length, okay? And then every top drawer will have a 30cc syringe and a CO2 checker that you put in between the King and the ambu bag to see if you're in the lungs. We'll also have a flow meter, extra tubing, ambu mask, suction, oral suctioning, long nasal cannula, Veni mask, ABG kits, non-rebreather, ear probe. If you can't get a pulse ox, put this ear probe on. It will work with your blood pressure machine, and we have an extra one. If there's an emergency and we're not there, just pull this drawer open and take anything you need to get that patient some oxygen. Also, we have the bite blocks. We've got 3 different sizes. If you're going to ambu a patient, this needs to be in to move the tongue out of the way so that the air can go in. Drawer. Drawer, medication drawer. And the epi, here's how you use it. Open it up, and they say 1 amp of epi. This is 1 amp. Pop open each of these, and then you screw it in. And then you're ready to go. All right, your IV start drawer. You got flush. You got some extra bags right here. Dextrose. You got the IV start kit. You've got an extension set. You got angio caps. True code blue with the patient that is unconscious. Immediately you're going to go to the interosseous. This is what we're putting in if a patient is unconscious. If a patient is conscious, we're going to put an IV in right away. Here's the interosseous kit. This kit. And you open it up, you have the drill, and you've got the needle and stabilizer kits. You got the cleaner. You want to clean the area off. If you're not sure, remember the drill points. You've got a little cheat sheet. Okay? So I'm going to use this, the small one. This one generally goes in the tibia. So you pull the case off. So we're going to drill it in. Just let it drill right in. There's no threads on it. And then once you're done with it, you unscrew it. You hold it right here, and you unscrew it. Pull that out. Now you put your support piece over it. You gotta you pull these off first so it'll stick.
Just simulate.
Yeah, and then once you get it on there, screw this down, and then you flush it, and you're ready for meds. It's got a 95% success rate. Okay, the AED machine right here. Unplug it. Every code card will have an AED package. You undo it. It's ready to go. Triangle to triangle, and these are self-explanatory. Look there. Side of the chest, upper left chest, upper right chest rather. There and there. All right. Once you have the patient hooked up, you turn the power on, and then you follow the directions.
Push analyze. Analyzing now. Stand clear.
Stand clear.
No shock advised.
No shock advised.
Start CPR.
Continue CPR. And this is where if you want to see the rhythm, you open the door, and there you go. Normal sinus rhythm. Ventricular fib. Brady. VTAC. One we'd never want to see, asystole. All right, regulator, oxygen regulator. It should be around 1500 to 2000 psi. We're going to run this at 15 liters of flow. If you turn it and you're not getting 15, like see how it just went to red? Well, this must need to be cracked open. There we go. Now I cracked that open and we're full at 2000 psi. So when you hook up the Ambu bag, this bag needs to be filling up right here. Okay? How to properly Ambu a patient. Number one, these are in the top drawer, the bite blocks. You have multiple different sizes. The way that you tell the size is from the corner of the jaw to the lip, and that fits. So what you do is you go in upside down, and then you turn it around and you push it in. And that way it'll push the tongue back when you're ambuing. You have to inflate this. or it will not be productive. Got this going at 15 liters, full throttle again, and then I'm gonna hold a good seal with both hands against the jaws and my thumbs like this, and then nice and easy. And you want a doctor or someone to listen for breath sounds, or we will use the CO2 checker in between to see if you're getting good airflow. Demonstrate technique for CPR. Make sure you lock your arms, and then cross your fingers like this. Use the palm of your hand. Make sure that you are pushing really hard on the sternum. Get over the top of it. 2 inches. Okay? You have to think about pushing the heart down and the blood flow going through the body. That's pretty hard. I mean, you got to really get down on it and get over the top of them for good technique. If you have to get up onto the bed, do it. There is a CPR button on the bed which will make it go flat. Alright. Here's our suction machine. Power button right here. We'll hook it up to the canister. We'll hit power. Turn a yonker. If you're not getting suction, one of these holes might not be covered. There you go. You heard the difference. Now you're going to get suction. Thanks for watching RHI's Code Car Ready educational video.